And I'm sitting with Cassandra Vieten, sometimes known as Cassie, who is the president of the Institute of Noetic Sciences in Petaluma, California. Hello, Cassie. I'm so delighted that you can join us for a few minutes.
Thank you. It's wonderful to be here.
Yes. You are absolutely a hero in my world because of this book that you have created, which is all about helping healthcare providers, especially mental health care providers, understands spiritual and religious issues, especially things like spiritual emergency. And as you know, I've been training people about this and writing about this for years, but I've never seen a book like this before, and my read of it it's just a fantastic contribution. So I want to thank you for that right away. And if you would kindly tell us a little bit about, from your perspective as a psychologist, why do you feel like this particular book is important right now?
Well, we've done some research, and others have as well, showing that the vast majority of mental health professionals, and that includes psychiatrists, psychologists, social workers, MFTs, all across the board, don't receive any or just very, very little training in any kind of spiritual or religious beliefs, backgrounds, or experiences. And that is in contrast to the fact that when you do big surveys of the general public, they will say that, first of all, 90% of people believe in God. And if you ask people what are their number one coping mechanisms, a majority of people will say things like prayer and going to church or my spiritual practice. We also know that people who are involved in spiritual practices or spiritual communities have better health and well-being, emotional and mental. And so it seems like a very big disconnect that mental health professionals don't receive any training in this as a potential resource for both assessing participants, our clients and patients, and also harnessing those practices and beliefs if they exist to aid in treatment.
Right. So the book is really aimed to help healthcare providers be competent, but what's been the impact for people who go to a psychotherapist with, let's say, a spiritual or religious issue, and then that person that they're seeing may be very well-meaning and have the best interests of their clients at heart, but not be trained in this? What are some of the downsides of the lack of education?
Yeah, I mean, I think first of all, if you think about someone who is experiencing a debilitating depression or anxiety or mood disorder, it is completely possible that they could go to receive treatment from a mental health professional and not be asked one time about whether they have a spiritual or religious belief system or background or set of experiences or practices, whether they have any religious or spiritual resources that can aid in their treatment, whether or not they have spiritual and religious issues that make their symptoms worse. It's not a standard part of assessment, and it's not a standard part of ongoing treatment. So just the leaving that dimension of people's lives out completely makes psychotherapy less effective. And then when they do bring up a spiritual or religious issue, often it's not unpacked in the same way that so many other issues might be. Like if a patient said, I'm having a really hard time with my partner, or I'm having a terrible time at work, or I'm having memories of an abusive situation in my past, a therapist might unpack that at length. Whereas if somebody said something about praying or God, a therapist might sort of be like, I don't know if I want to go there, and so that's not helpful to the patient.
Right. And unfortunately, sometimes people get misdiagnosed when we don't really recognize this area or don't feel at home in this area, recognizing some of the issues that can come up. And sometimes then people are treated in a way that's not ideal.
Absolutely. Yeah, there are very natural parts of religious and spiritual development across the lifespan, and also religious and spiritual development among people who are on a pathway toward working toward becoming more spiritually connected. And there are aspects of those paths that mimic psychiatric symptoms, but they're very normative for the spiritual path, and really, to be honest, for anybody's life path. But in particular, you can read many, many, many accounts of people who are on a spiritual journey, meaning that they're not only trying to work on their work life and their marital life and their parenting life, but they're also trying to work on their spiritual life, where they may fall into very deep, seemingly depressive states, but what they're really dealing with is a existential doubt, for example, about the meaning of life. And having that dark night of the soul is a natural part of the journey. It doesn't mean that it should be not treated if it's debilitating to the person, but it certainly means that it shouldn't be immediately attacked as we need to make these symptoms go away immediately.
Oh, well said.
Because sometimes those experiences are not symptoms, they're actually natural parts of people's unfolding process.
I love the way you talk about that. That's great. And I personally think that there are an awful lot of people right now who are in a kind of existential crisis because we're facing the environmental issues of the day that are, the projections are very difficult to take in as well as to deal with. And a lot of people are thrown into, well, what makes sense? And it takes us really deep in consciousness. So,
yeah, I mean, in some ways, depression and anxiety in today's times is a normative reaction to what's happening. It's not an abnormal reaction. So the idea that we need to eliminate these symptoms using medication or other means, again, I'm completely for using medication for a debilitating, ongoing, intractable depression or anxiety, but without actually trying to delve into the meaning that it holds for people, or what do they think happens after people die, or what is the reason why some people suffer and others don't. Those kinds of existential, spiritual questions have been sort of relegated to not being in the therapy room because psychology has tended toward, in the last 50 years, either an analytic or a behavioral or a cognitive approach. And those are powerful approaches, but when you leave out the deeper meaning system that people hold about life and their identity and their values, you miss a huge part of what is feeding into people's experiences on a daily basis and what might be able to help them navigate those.
Thank you so much for saying that. We're very aligned in the way we think about it, and you're very articulate the way you say it. So, Cassie, I particularly believe that we really need more ways of reaching people to raise public awareness, as well as training programs to assist healthcare providers to move along and increase their knowledge as well as skills in helping people who are having these kinds of issues. So could you say a little bit more about how little there is right now? Really, your book stands out in the field, certainly for what's been written recently. And as far as I know, there are very few films or educational things that have been created to help people.
Yeah.
And so,
I mean, I think it's really important that, our book is meant for mental health professionals, and we've written a couple of papers in academic journals, but those kinds of materials are very kind of academic, scholarly, abstract, almost obscure, and they're only for mental health professionals who seek them. And I think that the power of a film to be able to reach out to destigmatize the connection between spirituality, religion, and mental health is one very powerful thing, because film works not only at the narrative level, it also works at the visual level, the emotional level, the storytelling level. And that gets through to people in a different way. And I also think that it's not just the mental health professionals, but it's the patients or the people who are seeking help that need to have the door opened for them, or have an invitation to know that other people have had these experiences, that they deserve to have professionals work with them in a way that is respectful of their spiritual and religious beliefs and practices. And just that they're not abnormal. These are experiences that people have. So I think in a way a film could reach out to many more people than a book or an article or something like that. So I really hope that you're successful with the film.
Thank you so much. I appreciate that. Well, we're fundraising now, and we have high hopes for getting this film out by the end of next year, 2019, or the beginning of 2020. So it's been a pleasure to talk with you, Cassie. And
Wonderful. Well, thanks, Emma.
I hope we get the opportunity to talk again. Thank you so much for
All right.
being with us today, and I'll say goodbye
Thank
for
you.
now.
Thank you.